want to grow. I feel like I want to do some consulting work. I want to do bigger things than what I'm doing with health communication. I want to be that resource when it comes to health education and health communication. And in every aspect of public health, we have health education. We're educating those people on like to decrease disease or decrease risk factor like obesity and screening. So just that education piece, I want to be a part of with the curriculum design. I also want to pursue other things too, not just I am health education, but maybe start other businesses that will help the community. Again, I feel like if it's not public health related, then I'm probably not gonna really do it. I think I'm here for a reason. I mean, public health is just, I always love public health. I love the different avenues you can do and the different concentrations you can concentrate in.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. I enjoyed talking with Nakia today. She's highly ambitious and doing a lot of great health education work. In today's episode, you'll hear and learn more about the positive impact that can be made in a professional, academic, and community setting, and how you can really navigate all of these. How Nakia created I Am Health Education out of a need and questions that she was just consistently being asked by people in the field. And then from this, it really shaped into her creating and sharing resources in a more formal way, especially around supporting people that are trying to get community health education specialists certified and really supporting them in that prep. And then her decision to pursue a Doctor of Health Science. I think this is an important conversation. So if you enjoyed today's content, all I ask is that you hit that subscribe button, leave a review, and share it with a friend. This really helps the show get out to more people. So hit that subscribe button, leave that review, and share this with someone who gets some value from it. Thank you. Enjoy the show.
Hi, this is Kia, and I am an associate adjunct faculty, and you are listening to Public Health Careers.
Today, we have someone committed to empowering individuals through education and promoting equitable access to health resources, with a strong dedication to making a positive impact in professional, academic, and community settings. She conferred an associate's degree in general studies at Ivy Tech Community College and then continued into a bachelor's in health sciences and health promotion at Indiana University South Bend. She then conferred a Master of Public Health at Indiana State University. She recently started her Doctor of Health Science at the University of Indianapolis and currently works as an Associate Director of Community Partnerships while also being the Executive Director of I Am Health Education. We have Nakia Bolden, MPH CHES. Welcome to the show.
Thank you for having me.
Truly is my pleasure. I appreciate you taking time out of your Saturday morning to have this conversation with me. It's a pleasure.
Yeah, thank you.
So tell us, how do you identify, and tell us a little bit about your personal background?
So I identify as a cisgender woman, an African American woman. A little bit about my personal background. I live in Indianapolis, Indiana. I have 3 children, and that's about it when it comes to personal background.
I'm grateful that your children are giving us the time on the Saturday morning to have this conversation. Then, but shout out to all the moms out there. I know you all do an amazing work. Getting more into the conversation. So you have a platform called I Am Health Education, which focuses on providing certified health education specialists, exam preparation, courses, and resources. Could you share the inspiration behind this initiative and how it supports aspiring CHES professionals?
So when I became CHES certified in 2020, I passed my first time, and then I had people reach out to me regarding study tips and resources. So at first, I would just, send them the PowerPoint that I use. Then eventually, I created this CHES bootcamp. We did it over Zoom last year. It was a 4-day event, and we really gave those people like resources, study prep. We had a mini exam and just answered their questions through one-on-one feedback for them to pass that CHES exam. When I did that, I think one of the barriers to that was having that commitment to being on Zoom for 2 hours for 4 days a week. So then I made that into a CHES prep course. And they still have that mini exam, those study tips and study guides and resources. And now I have a community forum where we all come together to share like what we need help on, what best practices are there, and any other tips for studying for the CHES exam.
I love that it came out of a need, or like you just being good at doing something, and then people were like, "Hey, can you help me with this?" And then
Yeah.
from that, it was you realize that there actually was an actual need, and then build out the support around that. But yeah, I appreciate that work, and we'll talk a little bit more about getting started into this a little bit later on in the interview. What does public health mean to you?
Public health means so much, right? Because there's so many different avenues in public health. Public health means preventing disease, saving lives, and saving money. So that's public health, saving lives.
And could you dig deeper into the saving money part of that? Because that's not a theme that I've heard many people say on this show, but I do think
Um,
it is true.
yeah, saving money means it costs way less to prevent a disease than to treat it. It costs less for me to get a gym membership to exercise than to get obesity, and then those risk factors come up with cancer, heart disease, high blood pressure, and those diseases we saw, especially with the COVID-19 pandemic. We saw that if you're obese, you're more likely to suffer from adverse events associated with the COVID-19. So just preventive care is way cheaper than the other care.
It absolutely is, and I think that that's one of the kind of focuses that we don't speak about enough in public health, or are able to raise up in a way that makes sense. Is like naming, okay, this is what the financial gain is, whether that's for like the health system or the health savings or the betterment of life, or just better quality of life, is important. But just thinking about how we can implement and think about public health in all these different ways, because it is important to show from that perspective that public health is saving money as well. And yeah, there are many like very startling statistics out there, but yet the investment in public health is where it is, unfortunately.
Yeah, it is.
So tell me when this was in your journey. You were a donor center technician too, and a lead phlebotomist. I almost said a lead phlebotomist, but a lead
Yeah.
phlebotomist at Biomat USA Inc. When was this in your journey? And tell us about getting into those experiences.
Yeah. So when I started my journey, starting college, I didn't choose public health. I chose nursing. But I know I wanted to get into that health field. So Biomat is a plasma company, and that's where I started my health journey in a sense. So I started in 2013 in the plasma industry. I was a donor center tech, screening people to make sure they're eligible to donate plasma. And then I was a phlebotomist collecting that plasma donation and processing that. And then at the same time, I was going to school to get my associate's degree in general studies. And then um, I started a program at Valparaiso University in nursing. And then I saw public health. And once I see that, I was like, I think I want to do public health. So that's really how my public health journey began.
I think this is like a very common theme in like public health journeys. Like you wanted to become a nurse, you wanted to become a PA, you want to become a physician, and then from going down that path, you realize there is this thing called public health, which in many ways needs a better way to be advertised and to be shared with people. And I think like this is one of the reasons I continue to do this podcast, is because this is one of the ways I could potentially get shared with new people to understand that this is work that you can do, because many of us don't know it until too late. But okay, so going down the path, you're thinking about going into nursing. You became this donor center tech as well as a phlebotomist, so that you're getting like hands-on experience working in like these clinical types of settings. While you're doing this, you're also doing your associate's degree in general studies at Ivy Tech Community College. Tell us about the path of, or like the thinking for you of going the path of community college, which is a way, like a path, I just want to say that I advocate for
Mm-hmm.
for many people out there, and I think it is hugely beneficial and underutilized by so many people. But that's another conversation for another day. But tell us why you decided to do these two things at the same time on your path to getting into nursing school, or going down that route of pursuing nursing.
So with Ivy Tech, so I initially started at Purdue. I did a semester at Purdue. I had a baby, so then I left Purdue, And then it was just like, I didn't really know what I wanted to do. Like I did a semester of nursing at Purdue, but I was like, I don't know if I want to do nursing. I was just going to I think it started out as a degree, associate's degree in health science, but it took me 3 years to get that. So then it just turned to a general studies degree. Um, and when I started my journey at the plasma company, I liked it. I like healthcare. I knew I wanted to get in healthcare. I just didn't know it was public health at the time. So I liked it. I enjoyed it. So I just kept going. Um, then once I graduated with my associate's degree, I went right on to my bachelor's. I graduated in, I think, May 2018. Then I started at Indiana University in fall 2020. 18. And then I switched to plasma company. I started working in a hospital. So then I was working in a hospital during that time as a phlebotomist.
So you got your bachelor's in health sciences and health promotion at Indiana University South Bend.
Yeah.
What was the thought process going into there? Was that still nursing at that point in time, or did I miss you saying something there?
No, it was not. So Valparaiso University was after I got my associate's degree and before I started with Indiana University. So at that point, I already decided it was public health, but Indiana University did not have that public health degree. They had something close, which was health promotion. So I started in health promotion with a concentration in health promotion, but the degree was in health sciences. And I liked it. It was program development. It was health communication. It was all those things. And then I graduated and COVID-19 was right there. So I started working in public health right there.
Wow, that is a very tough reality of what I think many people have faced in these last years of like graduating or like wanting to do a lot of public health work and then getting into the pandemic and doing a lot of like COVID-19 public health work.
Yeah.
And just a very transformed public health landscape and workforce in so many ways. So like I shout out to you and everyone else out there like you that graduated during the pandemic, because like I couldn't imagine what that would have been like doing that.
Yeah. I didn't even walk across the stage. Like I didn't even finish my final project. We was going to implement this sex education campaign at the local health and wellness place on campus. But yeah, we didn't even walk across the stage. We graduated in May. We had a virtual graduation, and then I was working in public health that same month.
I'm sorry to hear that, but I'm glad that you were able to do the work to get where you are, and we're here to share more about the experiences that you had during that time. And I could imagine that how important they were and fundamental in where you are right now. Throughout your undergrad degree, you had many positions. I'm just going to name all of them because I don't want, and then you can go through them and tell us what you did and how they kind of evolved into one another. Because yeah, it gets a little tedious when I'm asking 5 different positions. So regardless, anyway, so you were a preventive intern at AIDS Ministries, AIDS assistant. You were a medical lab assistant at Elkhart General Hospital. You were a health promotion specialist intern at St. Joseph's County Department of Health. You were assistant athletic trainer aide at Indiana University South Bend. And you were lead investigation specialist COVID-19 at Guidant Global. So walk us through all those experiences.
So I needed an internship to graduate, and that's why I chose the preventive intern at the AIDS Ministry. And the same with the health promotion specialist internship at St. Joseph County Health Department. I needed that internship and that experience. And South Bend is relatively small, so you don't really get a lot of public health opportunities and jobs. So because at that time, one of the directors of that health department, she was a adjunct faculty at the Indiana University, and she actually graduated from there. So that, that partnership was there. So I took advantage of that partnership. And throughout my academic career, as you'll see, like I've always worked. So I was a medical lab assistant at the Elkhart General Hospital while pursuing my undergrad degree in health sciences. And I was processing laboratory specimens, urine, just other bodily fluids like that. And I was also collecting that blood sample and processing that as well. For the athletic training position, it was an opportunity there too with the partnership with one of my professors. and she was an athletic trainer. And she had a partnership with one of the athletic trainers on campus. I saw that and I was like, I'm gonna see if I can do it. So that was interesting, doing that and supporting those sport uh, athletes on campus. And then the lead investigation specialist with the COVID-19 that started in May once I graduated.
I like the point that you made, and I think it's a conversation that many people have with themselves, like being in a place that doesn't have a lot of public health opportunities, and just how you have to go and search for related opportunities that you can apply or learn public health related work from. And like to your point, is understanding that there was the partnership there, and you were able to leverage that to build on experiences and exposure, as well as like say, oh, there's this athletic trainer thing going on, let me see if there's something that I can do there, and just really like take it upon yourself to find how you can utilize the opportunities that are out there to better yourself.
Yes, yes. So yeah, that was interesting.
Before we get more into, I guess, the COVID work that you did, were there any undergrad takeaways that you wanted to share with us?
Yeah, school's important. Like undergrad was great, but it didn't really prepare me, I feel like, for COVID-19, of course. I mean, who would have known it would be a huge pandemic? So in hindsight, which is always 2020, like looking back, those skills I learned, those program development courses, that diversity course, they play a great part in your career as a public health professional. So you definitely want to take advantage of those. But when I'm in that position, like in those classes, I didn't think I would ever really use them. I never thought it would be a pandemic. Um, so yeah, just take advantage of those courses and save those books and textbooks. It a bit.
Yeah, absolutely. And maybe even try to get a digital copies because some of those
Yes.
textbooks are large, and I still have a couple of them. And yeah, but definitely great advice. So between your bachelor's and your master's degree, you said you started off in that COVID work. You were also a communicable disease investigator at the CDC Foundation and a public health investigator at the Indiana Department of Health. So tell us about those experiences, what you did in them, how'd you get into them?
Yeah. So with the lead investigation specialist with COVID-19 at Guardian Global, that was like a contract. I was a contact tracer, and that led me to see this position with the CDC Foundation. Um, and I applied. I didn't think I would get it, but I applied. So I'm like, oh, this looks so cool, and I have the COVID-19 experience, and that's how I started with that. And with that position, both of them, they're the same. They're just funded by different people. The CDC Foundation, that was a grant funded position. And once that ended, it was taken over by the Indiana Department of Health with knowledge services. So that's just one and the same, just different title, different funding sources. So I cleaned the COVID-19 data. I merged different cases. It was just very data analyst, data management. I just looked at data all day and just did different research like that. So that is what that position was in a nutshell. And even when I was a vaccine demand strategist, I was also between bachelor's and master's degree. And I saw that as the next step. Like, okay, I contract trace, I cleaned the COVID-19 data, and now let's use this data to develop evidence-based ways to increase vaccination rates when it comes to COVID-19. So that's how I got started with that. And that ended in 2022. And that was my last COVID-19 position.
And how exactly did the first COVID-19 position lead you to learning about the other COVID-19 position at the CDC Foundation?
Um, I like the CDC Foundation. It was a great company to work for. Pay is great. 401k match is phenomenal. Like it was amazing. Um, so once that grant ended, I really did want to stay on. So when I saw the position, it was posted by my former manager at the time. I applied. I was like, oh, I would love to be on the vaccine demand work. And at that time, they required you to have a master's degree. But I did not. I only had my bachelor's in my CHES. But because I was CHES certified, I got to take advantage of that opportunity. And that was amazing that I took advantage of. I didn't even interview. I did like a phone interview. That's it, and I was hired. I was like, yay.
That's lit. That's lit. Shout out to you. Like that, I think there's a lot of great things that you just said there. Firstly, saying that you didn't think you would get the first COVID-19 job with the CDC Foundation, but you applied and you got it, and then that just kind of opened up your eyes and created these new connections for yourself to be able to do that, as well as I've heard time and time again just how valuable a CHES could be in someone's arsenal as they're developing their career, especially if they don't have a master's degree at the point in time. And like that, this is case in point there that like that was so fundamental in you getting that position.
Yeah, it really was. Like it was amazing. I tell people that all the time. Like it opened up doors for me when I have a master's. Like it is a great benefit for sure.
So I don't think I did ask you about your CHES, and I'm guessing that you probably did that throughout your bachelor's degree. Tell us tell us about why you wanted to pursue a CHES.
So during undergrad, they pushed it. It was just like, when you graduate, you're gonna take the CHES exam and you can create canned programs and do this and that. And then once that COVID-19 pandemic happened, I didn't lose sight of that. I was like, I'm gonna take the CHES. Like it was just like, okay, next step, CHES. And I took that CHES in October 2020, and I became CHES certified. And then in November, I created I Am Health Education because I'm like, I just wanted to do something that was not COVID-19 related. So that's how I started that.
Okay, that makes absolute great sense, and I love that, and completely understand you not wanting to do anything COVID related. I feel like a lot of people were just tired of hearing that, especially people in the public health realm.
Yes, for sure. Sure.
But that's also nice to hear that your program, it was like just like the next logical step to get certified as a health education specialist, because I'm thinking back to like my master's program, I could have gotten the exam paid for free by the school, but I didn't apply it on time or whatever the case
Yeah.
was. And like that is like one of the small regrets that I've had, because I think it would just be beneficial overall. But neither here nor there, but
Yeah.
just to say that like CHES certification is something that's very, very valuable. I think especially if you have a bachelor's degree, and especially if you're just trying to like do something to stand out. And many of your programs either pay for it or have study resources for it.
Yeah.
As well as I know Kia is going to talk more about some of her resources in a little bit, because as we were talking about earlier, she was the person that passed it, and then everyone was asking her for questions, and then she saw that there was a need to create resources that could help people. So before we get into that, you decided to pursue your Masters of Public Health at Indiana State University.
Mhm.
What was that thought process of going into your master's program?
So originally, I wanted to stick with IU. I'm an IU alumni. I love IU, but IU did not have health. They had health communication, which I applied for. I got in, and that was a Master's of Public Affairs in Health Communication. But once I got in, it's like, oh, we discontinued the program. It's just Masters of Public Affairs in Health Systems. I was like, okay, I just take it because I love IU. So I took that, and it just was not for me. I did a year, and I'm like, if it's not public health or preventing disease, I don't want it. So then I saw this opportunity with the Masters in Public Health at Indiana State University. So I was like, I'm gonna do that because I need my MPH. Plus, since I was on the COVID-19 response, I saw that everyone had their MPH. So then I felt like maybe I don't have enough education because everybody has it but me. So I'm like, the next step, master's degree in public health. And I want that MPH after my name. That's mostly what that was. Um, so yeah, so I started that, and it was amazing because I was working while going to school. And I felt like that made it so easy to apply what I was learning in the field to my study.
That is the best combo that you can probably have. Like, and I think like your trajectory, and not to say that any journey is perfect, but having the opportunity to be able to gain experiences in public health after your bachelor's before going into a master's, and then also working during a master's program just provides so much opportunity for you to really develop and hone the experiences, and just take a lot of the theory that you're learning in class into reality, and just make it so much more tangible and actionable and helpful for you in your journey.
Yeah, it was definitely beneficial. I seen that. And even in interviews, they was like, oh, you was working while going to school? I'm like, yeah. So now I got that experience and that education.
Right. So definitely, if you're able to do that, definitely advocate for it. Even if it's something that's part-time or an internship, it's always helpful just to have any type of experience that you're working on. So you started your master's and then you started the business. You became the executive director at I Am Health Education.
Mhm.
I know we spoke a little bit about this earlier, that you do a boot camp, you have courses, and you have a community.
Yes.
When you started this, what was that thought process? You shared a little bit earlier that you passed your CHES, people were asking you questions, and then when was it that you realized, oh, this is something that I could actually turn into I Am Health Education?
I had a meeting with I don't even remember her name, and I might have to give it to you later because I can't even think of her name. But she looked at my resume and she saw that I had a business. Again, at that point, I was just giving out free resources. It was just CHES related, just CHES resources. I think I had a few videos on YouTube and just different things like that. And she was like, I see you have this business. And at the time it says consultant. She was like, some organizations won't hire you because they're gonna think you're gonna take their business away or whatever. And she was like, "Is this a legit business?" I'm like, "Yeah, but I'm not registered with the state yet. I was just doing things at that point. I wasn't really trying to make it, legit. So you should register that because if you don't, someone else will." So I did that. Then I started that Zoom meeting because again, I still had those people reach out to me asking about the CHES. And I also had a video on YouTube about like the CHES process for studying, but it was like a short video. I think it was like 30 minutes. So then I turned that into a legit business, a corporation. And then I started really advocating for CHES. I created that CHES course over Zoom. That's created that course that's just self-study course. And also partnered with other CHES individuals to talk about best practices and study tips for getting that CHES.
It's interesting, firstly, that you say that it's a short 30-minute video, but I understand what you're saying there. But first thing I would say is I Am Health Education is a great name, and it's a good thing that you did get it registered, because I definitely think someone would have taken up that name. So kudos for you for taking the action, like maybe even not knowing that you were ready to take that action, but taking the action and building it out. And then from there, building out all these different resources that people can use to just really understand the CHES and navigate the journey to passing the CHES a little bit easier. So you said, and I looked on your website, I think your course is like 5 hours of content there.
Yeah.
if so definitely advocate for you all to go check out the course. But let's say someone's listening now, they're thinking about taking their CHES. What are like the 3 pieces of advice that you would give to them to do their best?
Take the mini exam to see where you struggle with. Get the book, like get that book, take the mini exam. Once you figure out where your trouble areas are, focus on those areas. Also get a study group. That helped me. I co-founded a study group when I was studying for the CHES. So connect with a study group, connect with like-minded individuals, bounce ideas off each other. I feel like those are great things to do. And that's what I did. And it definitely helped.
So those are tangible things that you can take. And if you want to learn all the other things that Kia has learned and shared, like definitely check out I Am Health Education as a resource for you along your CHES journey. So thank you for sharing that.
Yeah.
And I guess, since before we move on to the other positions, like you've had I Am a Health Education, I think, for a couple of years now. What has that transformation looked like from that, like maybe from like when it became formal to now, and what have you learned as someone with a business?
It costs money to make money. That's like sometimes it costs too much money. But yeah, so it just honestly started out as a website. It started in 2020. It started out as a website. I had a few videos and that grew to like I have YouTube, I have LinkedIn, I have social media platforms. And I also sell merchandise. It's not just health education, it's public health. I sell cups, mugs, bags, shirts, hoodies, all that. Just using Canva, I just design things. I love health communication. So it just, I don't know, I like it. And it's grown. And by something you like to do, but sometimes you just got to create it. You just got to create what you like to do because you can't find that position that meets every checkbox that you have.
Absolutely. I think more and more about that as like the creator economy and like what that means for us as humans and how we are solving our own problems, and in solving our own problems we are creating businesses that people would like want to support if you're able to monetize it. Like case in point, you solve the problem of being able to pass the CHES exam easily with your techniques, and then from that other people had that same problem, so you created a resource for them, and that's how businesses are going to be created in the future. But this is just a tangent that on like my thoughts that aren't really related to public health, but I just think like that what you said just resonated with me in that way.
Yeah.
And I also wanted to highlight the point of you saying that you started at IU University in that MPA, but realizing that that really was not the fit for you, and you really needed to get like a public health degree and a master's of public health. And that was also something that got supported, or the idea of having a master of public health got supported by the people that you were working with, and seeing that many of them had masters of public health, and just how that could like create opportunities for you in your journey.
Yes, for sure. I it was definitely beneficial. And I'm happy I see that because I don't know if I would have pursued a master's degree if I didn't see like that everyone else had it.
Yeah, that's why it's important to get exposed and put yourself out there and go into rooms to just understand, because I had no idea what a DRPH was, but it's a thing, and a
Yeah,
lot of people have them out there. But if you're not in the rooms or not exposed to ways to learn about those things, it's kind of hard. So definitely, especially if you're in high school bachelor's programs, like just get exposed to different things and just expand what you know, because there's so much out there that you don't know at this point in time.
exactly.
And I still don't know, a lot of things.
Yeah, exactly. Because I think a lot of people think it's just PhD, that's it. But no, oh my gosh, there's so many doctorate degree options. So
Right. And then when even you break down like a PhD in so many different
yeah,
things that you can get a PhD in, but hey, yeah, okay. So during your time in your Masters of Public Health program, you said that you shifted over from, or you got a job as a vaccine demand strategist at the CDC Foundation, as well as you worked as a disaster program intern at American Red Cross. So can you reiterate the story of you getting into that vaccine demand strategist program, and tell us then
yeah,
how you progressed into the other program and what you did?
yeah. So I mean, at that time I was cleaning data for over a year. So I was like, I'm just kind of over it. So I was like, I saw this position as a vaccine demand strategist, and I'm like, the next step on the COVID-19 response is creating these different initiatives and programs to increase vaccination rates. So that's how I got interested in that program. And my manager, Pat, was promoting that position. She was the hiring manager. So then I applied. I did a phone interview, and then that's it. I got it. And honestly, I thought it was a scam. I mean, mind you, I worked there before, but I'm like, how do I get this position? And I didn't do a really formal interview. But again, having that connection with her. Um, so yeah, I was a vaccine demand strategist. I was looking at the different vaccine data, doing a needs assessment of the population, and then looking at evidence-based ways to increase vaccination rates. One of the things that I did there was I created a mail out reminder cards to increase vaccination rate because I saw that a lot of the percentage of the population did not have access to the internet. So just making sure they're aware of getting that COVID-19 vaccine. And I designed that with Canva, which I love. And that resulted in like a 10% increase in vaccination rate, which I'm so happy for. So after that, I left. The grant ended. I left, and I started with the American Cancer Society. And then as I was finishing my master's degree in public health, I needed to do an internship, which I was pushing back for because I'm like, I have experience. I don't need an internship, but I'm happy I did it because when I was a disaster program intern with the Red Cross, it's a different public health. It's emergency management. It's fire safety. It's all those things that you normally don't associate with public health, but that's definitely public health. So I learned a lot and I made some great connections.
That's amazing. And I think it's just so important to highlight that public health is in so many things that we don't traditionally see it in. And you just need to be able to see where the intersection is and where you can really like build off of the skill set. So appreciate you sharing that, as well as shout out to you for like looking at the data and seeing like where the need is and understanding that these people literally don't have the internets and they are not using technology a lot of the ways in the same ways that you and I are using it. So let's send it out to them in ways that they will actually get the information, because many times we don't think about broadband issues or broadband deserts or the economics of broadband, especially in rural communities or communities of older people. But these are like real challenges that are out there. So shout out to you for that. So before we move on from your Masters of Public Health, were there any takeaways that you wanted to share with us?
Yeah. So I thought I was an expert, right? I was an expert in needs assessment. I've done it before. I've been working in the field for years. But with the Red Cross, I had a situation where I was at a health fair, and I just was like, "You want to go to this health fair, kid?" Sure. So I represented Red Cross. I didn't do a needs assessment. I just thought, okay, I'm just gonna go there and have this English material. But the majority of that population was French Creole speaking, and I didn't have nothing in French Creole. So just humble yourself. Like always, just verify, like you know your population no matter what you're doing, because I could not help them if they didn't understand what I was saying, what I was presenting, and the information I was giving.
That is real. And yeah, to that point, we need to be sure that we are understanding where the communities are so that we can actually meet them where they're
Yeah,
at. The golden rule in public health, that's what I'm terming it, the golden rule in public
yeah,
health. So yeah, and I think like just cultural competency, cultural awareness, and understanding are huge parts of public health, especially when we are dealing with quote unquote marginalized populations, because we never know what are their ethnic backgrounds and all these other variables that we just don't traditionally think about because of systemic reasons. But
yeah.
neither here nor there once again. But yeah, appreciate you sharing a lot of that. So after you graduated, you became a cancer support strategic partnership manager. Can you tell us more about that position?
Yeah. So I actually started that position while I was getting my master's degree. Um, I started my second year of the program, and then I saw that position with the cancer support strategic partnership manager. It's such a long time. So with that, I partnered with different organizations to decrease cancer rates in Indiana. I developed initiatives prominently targeting those 5 cancer areas: breast cancer, colorectal cancer, lung cancer, skin cancer, and just partnering with those different evidence-based uh, strategies, and then partnering with those evidence-based organizations. Um, Eventually, so there was they had to do a revamp of the organization. So when I was hired, they told me that they're going through a reorganization, they're going to revamp it. So my title may change. So then that title changed from cancer support strategic partnership manager to associate director community partnerships. So now there's just a primary focus on FQACs and community-based organizations. So partnering with those organizations to decrease cancer rates and increase cancer screening in India. So yeah, there was really just like they did a reorg, they laid some people off, unfortunately. I made the cut, thankfully, and then the title changed a little bit. So yeah.
And in that title change, none of the role that you were doing specifically changed.
So when I was hired, they knew things were going to change. So I didn't really do a lot,
Mhm.
honestly. And then once that change, honestly, and once that change happened, it's like, okay, now you're going to just partner with community-based organizations and FQACs. I think before it wasn't no focus. It was just like everyone was cancer support, and you were either senior cancer support or just like cancer support. And you partied with FQACs, cancer centers, and medical systems. You did all of that. But then the focus became FQACs and community-based organizations, cancer centers, and medical systems and insurance. Those were the 3 specialties.
And what was the process like for you to build those partnerships or those relationships with those types of organizations?
It was interesting. You have to come up with some creative ways. I've had to call people, I've emailed people, I've reached out to LinkedIn for different organizations. It was interesting learning about what the different organizations were doing, their priorities. I think oftentimes, of course, cancer is the second leading cause of death, but their focus is on heart disease, It's on unintentional injuries. It's on different things like that. So just developing that communication and that plan to partner with these organizations so they can see how great it is to focus on. I mean, of course, you want to take consideration those other diseases, but like cancer and screenings and just different ways to do that.
Just talking about the intersectionality of the issues, or maybe like, and this is just me assuming once again, but just talking about like many of the patients might be the same population. So like, how can we come together to support that in many different ways? But yeah, and I think that is a lot of the work that public health needs to continue to do, or needs to happen in public health, is like just cross partnerships, just understanding what other organizations are doing. How can we partner with them? How can we both work together to move things forward? So yeah, I appreciate you sharing some of that.
Yeah, it was definitely a great opportunity. I learned a lot because I didn't use capacity building really in other positions that I had, besides maybe vaccine demand strategist. But with that role, it was mostly just capacity building and partnering with organizations.
You are currently a Doctor of Health Science student at the University of Indianapolis. Tell us about that thought process of wanting to decide to get this degree.
So I am a lifelong learner. That's probably why I have so many different degrees. I'm a lifelong learner. I like teaching. I like learning and just different things like that. So I want to do the DRPH. But by the time I decided to pursue my doctorate degree, a lot of that was closed and had already started. But this opportunity came up. It was still open. I'm like, I'm apply. I saw the curriculum. It was more of a health education, health disparities, and research. I'm like, okay, I want to get into this. I think my goal was to be on the C-suite. I wanted to teach, and I really, really wanted to get into research. And I also had a mentor at that time. She told me, like, when you have that doctorate degree, it opens up so many doors. So people would think like you're more of an expert now in your field. And I really wanted that expertise with my business, and I want to grow my business bigger than what it is. And I think that pursuing that doctorate degree would give me that opportunity and skills and knowledge to do that.
And I know a lot of your journey has spoken about like that health education part of things. I don't think I might have had someone on who has a Doctor of Health Science before, but as you mentioned it there, it just seems like it's more focused on that health education aspect of things as opposed to DRPH, and definitely benefits to both. So can you tell us more about like deciding to choose this as opposed to maybe waiting another year for a DRPH program?
I don't know. I was like, if I don't start now, I may not go back. So I really wanted to try this and see if I like it. And I also was I was reviewing one of the CHES study books, and I was just the new edition for the 8 responsibilities, and on the back of it, it was like it literally said, you know, professional development opportunities, these following degrees, DRPH, and it said Doctor of Health Science. So I was like, this is a sign that I need to pursue this. Um, so yeah, I'm taking it. It's been interesting for sure, but I'm also considering switching to the DRPH next year and just transferring those credits. But I think DRPHs are more widely known versus the doctorate degree in health. But doctorate degrees are definitely different than master's degree. I feel like my master's degree was fairly easy. I hate to say that, but this has always it's been like you have to be on your stuff with the doctor.
That makes sense. And I like from your journey, because you said this earlier as well. It's like you started something, but then you realize this isn't for you, but you know that you can still
Mm-hmm.
pivot. Because I think too many people get caught in that procrastinating. Should I do this? Should I do that? Should I do this? But at the end of the day, no answer is the wrong answer. Like you're gonna have to do it either way, and you can always change your mind down the
Yeah,
line and figure it
yeah,
out. Yeah, most things in life are figure outable.
that's for sure.
Right. So how do you envision this, whether you continue on in the Doctor of Health Science or pivot across to the Doctor of Public Health, enhancing, strengthening the business that is I Am Health Education?
Um, I want to grow. I feel like I want to do some consulting work. I want to do bigger things to what I'm doing with health communication. Um, I want to be that resource when it comes to health education and health communication. And in every aspect of public health, we have health education. We're educating those people on like to decrease disease or decrease risk factor like obesity and screening. So just that education piece, I want to be a part of with the curriculum design. Um, I also want to pursue other things too, not just I am health education, but maybe start other businesses that will help the community. Again, I feel like if it's not public health related, then I'm probably not gonna really do it. I think I'm here for a reason. I mean, public health is just, I just love public health. I love the different avenues you can do and the different concentrations you can concentrate in.
There's so much that you can do in public health, and you can definitely find a lot of passion work in there. And I think, like, to your point and to your story, it is understanding that you know you don't have to box yourself in, but you can continue to learn and grow and expand on what you have and what you're doing and what you're capable of doing, because there is so much work that is to be done in public health and improving communities. So shout out to you.
Thank you so much.
And you're also an adjunct associate professor at the University of Indianapolis. Tell us about this experience, and because I know you also mentioned that you liked
Yeah.
teaching a little bit earlier. So tell us about this experience as an adjunct associate professor.
So I don't know when it started, but I've always wanted to teach. I just wanted to teach. That's why I have that course and everything like that. So I just wanted to teach. And when I saw that opportunity, it was with Dr. Heidi. I followed her on social media. She was MCHES. She has her MPH. She's PhD. And now I'm like, that is someone I really want to like possibly be my mentor. So I followed her. When I saw the position, I applied for it, and I marketed my CHES. I marketed my the CHES bootcamp course. I marketed all that, and then my experience with being a mentor too. And that's how that position came about for that opportunity. And I like teaching. I'm teaching health behavior theories, which of course part of the CHES. Teaching current topics in public health. I'm teaching drugs and social environment. I'm teaching a graduate course because I'm also pursuing my doctorate degree at that university. And I'm teaching a freshman course. So I like teaching. It has been interesting. Usually I don't talk in my job. I just, clean data or develop PowerPoints, but I talk for hours on Tuesdays and Thursdays. But I also feel like it's a professional development opportunity because I am strengthening that weakness that I feel like that I have. So I like it. It's definitely interesting.
Yeah, you always start off as an amateur in something and then you develop. So you got to start at some point to get to that point, right? So considering that many of your jobs before were behind a computer cleaning data, and now you're out in front of a class teaching students, what types of advice would you give to someone that is making that similar transition?
I feel like it's important to apply what you know in the field. Like, I don't just want to teach. I want to teach and be in public health. So then I'm sharing what I'm doing in the field with my students when I'm creating those scenarios, when I'm creating those projects for them to work on. I would tell people to go after what you like. Go after what you believe in. Take that risk. Take that jump. You never know where you may land. I think I've done that in my career, and that's probably where I've landed. Thankfully, some great places with great organizations. Taking that leap, and then sometimes if you take that leap and it's not where you want, like you said, pivot. Like there's always another opportunity there. So
Definitely heard a lot of that throughout your story, Kia. So I appreciate you sharing that. And before I move you on to like your last section part of the show, I did want to ask, because I think there's also a theme in your story around health communication and just how important that is in the work that you do in public health work. What kind of thoughts around health communication or maybe advice do you have for us and the listeners?
it goes back to that needs assessment, right? Knowing your population, knowing what worked best for that population. Um, Using resources like Canva, and I know a lot of organizations have that template you can use as far as like sharing that whole communication material. I'm always sharing communication materials on LinkedIn when it comes to like suicide prevention month, when it comes to these different awareness month in public health. So yeah, I would say knowing your population, knowing what works for them, and targeting and tailoring that communication to that population is very important.
Love it. And I think that that's important. And like the targeting and tailoring, very, very important. Because when we think about like marketing of any big corporation, Nike or whatever, they are
Yes,
doing that. They are doing that at scale. And public health has not reached the understanding that this is what we are competing with in getting our information out. Those big brands that know how to tailor um, information to the psychography of people, which is I think where public health communication needs to get to. We'll see. We'll see if it if it actually ever gets to
I'm
that
hoping it
level.
does. So I think with the pandemic, you saw a lot of misinformation on social media, and people got attacked. Like I remember, the Department of Health in Indiana, they made a post. It was just public health, just like I forgot, talking about COVID-19. And then people were attacking that post. So then I'm like, this is great. This is real information. Check out this website if you want to make sure that it's factual. And they started attacking me too. They're like, oh, she works in public health. Like she's the enemy. So yeah, communication in public health needs to get bigger because we need to fight that misinformation.
Yeah, yeah, absolutely. If you go under like any CDC posts on Instagram, you'll see a lot of that. And interestingly, many times the people that are making those kinds of posts, if you go to their profile, and I do like
Yeah,
research on this sometimes, I just check because it's funny sometimes and ridiculous at other times. But many of the profiles don't seem to be real. They don't seem to be. They look
yeah,
like fake profiles that people have made just to like spam the internet. I don't know how true that
that,
is, but it is a
yes,
little
that
disheartening.
could definitely be the case.
Right, right. Okay, so where can people connect with you and where would you like to see yourself in the
You can connect
future?
with me on LinkedIn. I'm very active on LinkedIn. I'm on LinkedIn more than anything. I check LinkedIn more than my email. And where do I see myself in the future? I see myself being important. I like to be in a vaccine demand strategist. I would love to be an epidemiologist. I would love to be an immunization part of public health when it comes to like preventing chronic disease or preparing for the next pandemic, which we know is going to happen, just a matter of time. So just being in that C-suite, that director type of position, that's where I see myself. I see myself hopefully being important. I tell myself I want to be so important that without me things crumble. So yeah,
Well, I would just like to let you know, though I do want to see you there, that you are important right now, and without you, things would crumble.
thank
So
you.
just appreciate that. But yeah, definitely some big things on the horizon. So I look forward to seeing where all your journey takes you and where we can continue to learn
Thank
from
you.
all your expertise. So moving on to the Furious Five, the 5 questions that I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
I would tell them to research what they really want to do. Um, like really ask yourself, what do you want to do? Why do you want to pursue public health? Because it saves you money from pivoting and changing your mind in the future, or making that second career change. So I would just tell them to ask themselves what they want to do and to connect with people. Create a LinkedIn page. Connect with people. If you want to do infant and maternal health, connect with those people on LinkedIn to see like what they're doing and see if you really want to do that as a career.
Great advice. Number two, if you're talking to someone wanting to get into your position, what advice would you give them?
I would tell them to take advantage of those certifications like the CHES certification. I also tell them to connect with individuals. I got a lot of opportunities by connecting with people, by being part of those Black women in public health groups. Sometimes you'll see positions posted that you may not see posted elsewhere. So definitely increase your connections. And I said again, leverage LinkedIn. LinkedIn is huge when it comes to seeing those opportunities that's not posted elsewhere.
Number three, what's something you're working on improving in your life right now?
I am working on improving thinking, right? I think a lot of times in my career, I mean, it's been beneficial, but when I get that offer, I say yes. I don't think about, do I really want this? How is this going to look like? So I feel like I've been seeing a lot of results from that as far as lessons being learned, think before you take that offer. Think before you take that leap. And it'll definitely be beneficial to you to think about like how this is going to impact my career, my personal life, my goals in the future. So definitely thinking. And that's what I'm working on now, just making sure I am mindful about decisions.
Number 4, professionally, do you recommend anything?
Yes. I mean, this book is right here, so I'm going to show you. But I love Viola Davis. I love reading. So yeah, here we go. Michelle Obama, The Light We Carry. It's one of the books that I'm reading now. Um,
Okay.
there's so many great books like on my book. Like there's so many books that I definitely would recommend. The American Public Health Association has this. They have a library of great books that I would recommend for those who are interested in public health or wanting to pursue uh, public health fields or get into a different avenue of public health. Um, yeah, that's about it when it comes to books.
Yeah, but I've listened to The Light We Carry as an audiobook for
Yeah.
our week book club. So yeah, it was good. I started Becoming, but I couldn't finish it. But that's maybe I'll pick it back up, or maybe I'll just get the audiobook. But anyway, last question, number 5. If there was one piece of advice you'd give to your younger self, what
I
would it
would
be?
tell myself to choose public health so I won't waste time um, doing nursing, um, taking 3 years to take my associate's degree in journal studies. So I would just be like, hey, whisper in my ear, public health, and then just go from that and keep on. And I probably would be done with school by now. But who knows? I might have missed out on opportunities by picking that from the beginning of my career journey.
Insightful, but definitely grateful for everything that you did do in your journey to get you right here and on the podcast, for sharing your insights with us. So thank you so much, Kia, for coming on and taking time to share about your journey and your experiences.
Thank you so much for having me. I greatly appreciate it. Your podcast is amazing. So,
Thank you. Trying to make it amazing, and it is always great when I can have amazing guests like yourself. So I appreciate you coming on once again. Uh, Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a review and share it with a friend. Greatly helps the show get out to more people. So definitely do those things. See you all next week. Peace.